Our ability to breathe effortlessly is something many of us take for granted. But for millions worldwide, every breath is a struggle due to respiratory diseases. Before we delve into the complexities of these ailments, it's essential to grasp the fundamentals of our respiratory system. Imagine an intricate, life-sustaining network that's constantly at work. This is your respiratory system. It's composed of essential components, including the lungs, airways, muscles, and blood vessels. Together, they work in harmony to facilitate the crucial exchange of oxygen and carbon dioxide. Oxygen, drawn from our environment, fuels our cells, while carbon dioxide, a waste product, is expelled. It's a delicate balance, but one that our bodies manage seamlessly. Understanding the system, its components, and their functions is the first step towards appreciating the challenges faced by those with respiratory diseases. First, let's understand the respiratory system. It consists of the lungs, airways, muscles, and blood vessels. Together, they facilitate the exchange of oxygen and carbon dioxide, vital for sustaining life. One of the most prevalent respiratory diseases is asthma, an inflammatory disorder of the airways. Asthma can turn the simple act of breathing into an exhausting endeavor. Asthma symptoms typically include wheezing, coughing, and shortness of breath. These symptoms arise due to the inflammation and narrowing of the airways, which restricts the flow of air into the lungs. Despite being a chronic condition, asthma can be effectively managed with proper treatment, enabling individuals to maintain a high quality of life. Moving on, we encounter chronic obstructive pulmonary disease, more commonly known as COPD. This term encompasses two conditions: chronic bronchitis and emphysema. Both of these conditions are characterized by persistent airflow limitation, coughing, and excessive mucus production. The primary culprits behind COPD are smoking and exposure to environmental pollutants. Over time, these factors cause the airways and air sacs in the lungs to lose their elasticity, making breathing increasingly difficult. Lastly, we delve into pulmonary fibrosis, a condition that hardens and scars the lung tissue. This scarring makes it challenging for the lungs to expand fully, leading to symptoms such as shortness of breath, persistent coughing, and fatigue. The precise cause of pulmonary fibrosis is often difficult to determine, but it can be linked to environmental pollutants, certain medications, and even genetic factors. Despite advances in medical research, we are yet to discover a cure for pulmonary fibrosis, which underscores the pressing need for further research and development of effective treatment options. In summary, respiratory diseases like asthma, COPD, and pulmonary fibrosis can significantly impact an individual's ability to breathe and, consequently, their quality of life. However, with a comprehensive understanding of these conditions, we can better equip ourselves to manage their symptoms, advocate for further research, and strive towards a future where everyone can breathe easy. Prevention is key to combating respiratory diseases. While these conditions can be challenging, adopting certain lifestyle changes can significantly reduce the risk. For starters, quitting smoking is paramount. It's no secret that tobacco smoke is one of the leading causes of respiratory diseases. Not a smoker? Great, but remember, secondhand smoke can be just as harmful. Next up, let's talk about maintaining a healthy lifestyle. Regular exercise strengthens the lungs and improves overall lung health. Pairing this with a balanced diet rich in fruits, vegetables, and lean proteins can bolster your immune system, making you less susceptible to infections that could potentially harm your respiratory system. Environmental factors also play a significant role in respiratory health. Limiting exposure to pollutants, allergens, and toxic fumes, especially in occupational settings, can go a long way in keeping your lungs healthy. And don't forget, if you're living in a region with poor air quality, wearing a mask can provide an added layer of protection. Now, it's not just about prevention. Regular checkups are crucial, especially if you're at a higher risk or have a family history of respiratory diseases. Early detection can lead to more effective treatment and better outcomes. Speaking of treatment, for those already living with respiratory diseases, several options are available to manage symptoms and improve quality of life. For instance, inhalers are commonly used to deliver medication directly to the lungs, providing immediate relief during an asthma attack or a COPD flare-up. Corticosteroids, on the other hand, help reduce inflammation, making breathing easier. In more severe cases, oxygen therapy may be recommended. This involves breathing in oxygen-rich air to ensure your body receives the oxygen it needs. It's important to remember, though, that while these treatments can help manage symptoms, they're not a cure. Consistent medical advice and regular checkups are vital to effectively manage these conditions and prevent complications. For those already living with respiratory diseases, treatment options are available. Inhalers, corticosteroids, and oxygen therapy are commonly prescribed to manage symptoms and improve quality of life. In conclusion, while respiratory diseases present significant challenges, understanding, prevention, and effective management strategies can help individuals lead fulfilling lives. We've dived deep into the intricacies of the respiratory system, the common ailments that afflict it, and the ways to keep it healthy. It's crucial to remember that every breath we take is a testament to this incredible system's functionality. Yet for many, the act of breathing is a daily battle. By comprehending the complexities of diseases like asthma, COPD, and pulmonary fibrosis, we can empathize with those affected and contribute to a world of better respiratory health. Prevention, as we've discussed, plays a vital role. Healthy habits, avoiding pollutants, and regular checkups can make a world of difference. For those already navigating these conditions, treatments exist to manage symptoms and improve life quality. Let's work together to ensure everyone can breathe easy.